is just another term used to indicate high blood pressure. And high blood pressure is a condition which arises when pressure of blood which is being pumped through arteries is high than required. Okay. So, what is hypertension? Hypertension is just another term used to indicate high blood pressure, and high blood pressure is a condition which arises when pressure of blood which is being pumped through artery is higher than required. It's called as hypertension. Okay. Or hypertension is defined as either sustained systolic blood pressure of greater than 140 mmHg or sustained diastolic blood pressure of greater than 90 mmHg. Okay. Hypertension is defined as either sustained systolic blood pressure is greater than 140 mmHg or sustained diastolic blood pressure of greater than 90 mmHg. It's called as hypertension. Okay. The agent that reduce high blood pressure is called as antihypertensive agent. Okay, the agent that reduces high blood pressure is called as antihypertensive agent. Next point is effect of hypertension. Okay, effect of hypertension. Okay, it increase risk of heart diseases. Next, heart failure, kidney disease, blindness. This is the effect of hypertension. Okay, next is type of hypertension. Okay, first type is essential. Okay, a disorder of unknown origin affecting blood pressure regulating mechanism. Okay, next type of hypertension is secondary hypertension. It arises due to some cause such as the secondary hypertension is arise due to some cause such as kidney diseases, abnormality of adrenal gland. Okay, This is the two types of hypertension. Next is environmental factor. Affecting normal blood pressure is, first is stress. Next factor is increase the intake of sodium. Okay. Third factor is obesity. Okay. And last factor is smoking. Okay. So this is the factor affecting, or environmental factor affecting normal blood pressure. Next, when the blood pressure is decreases, blood pressure decreases, it increases when the blood pressure is decreases, it increases the sympathetic activity. Okay. When the sympathetic activity is increases, it increase activation of beta 1 adrenoceptor on heart. Okay. When the activation of beta 1 adrenoceptor increases on heart, it increases cardiac output. Okay. As the cardiac output is increases, it increases blood pressure. Okay. So what happen when blood pressure is decreases? Okay, sorry, when the blood pressure is decreases, it increases the sympathetic activity. Okay, as the sympathetic activity is increases, it increases activation of beta 1 adrenoceptor on heart. As the beta 1 adrenoceptor is activate on heart, is increases, it increase the cardiac output, and ultimately it increase the blood pressure. Okay. Next, as the blood pressure is decreases, it increase sympathetic activity, then it increase activation of alpha 1 adrenoceptor on smooth muscle. Okay, as the alpha 1 adrenoceptor increase the activation of alpha 1 adrenoceptor on smooth muscle, it increase peripheral resistance. It increase peripheral resistance. Okay, as the peripheral resistance is increases, it increase blood pressure. Okay, next is, as the blood pressure is decreases, it decrease renal blood flow. Okay, it decrease renal blood flow. As the renal blood flow is decreases, it increases renin. Okay, as the renin is increases, it increase angiotensin second. Okay, as the angiotensin second is increases, it increases peripheral resistance. As the peripheral resistance is increases, it increase blood pressure. Okay, and next pathway is, as the blood pressure is decrease the renal blood flow, it increase renin and also increase angiotensin second. As the angiotensin second is increases, it increase aldosterone. Okay, as the aldosterone is increases, it increase sodium and water retention. Okay, as the sodium and water retention is increases, it ultimately increase blood volume. Okay, as the blood volume is increases, it increases cardiac output. Okay, as the cardiac output is increases, it increases blood pressure. Okay, that's it. The antihypertensive therapy is used to prevent complication of high blood pressure. Okay, the antihypertensive therapy is used to prevent complication of high blood pressure. Okay, next is antihypertensive drug. Okay, antihypertensive drug. Okay, so first drug of antihypertensive is angiotensin converting enzyme inhibitor. Okay, next is your calcium channel blocker. Calcium channel blocker. Okay, next drug is alpha 1 receptor antagonist. Okay, the next drug is alpha 2 receptor agonist. Okay, next drug is miscellaneous drug. And last is your diuretics. Okay, so this drug is used as an antihypertensive drug. Okay, next part of antihypertensive drug is classification. Classification of antihypertensive drug. Okay, so first class is angiotensin converting inhibitor. Okay, example captopril, enalapril, lisinopril, and ramipril. Okay, this is example of angiotensin converting enzyme inhibitor. Okay, next class is angiotensin antagonist. Okay, example losartan, irbesartan. Okay, next class is third class, calcium channel blocker. Okay, so example of calcium channel blocker is verapamil, diltiazem, nifedipine, next is felodipine. This is the example of calcium channel blocker. So next class is fourth class, diuretic. Example of diuretic: hydrochlorothiazide. Okay, next is indapamide. Next example is furosemide. Okay, and spironolactone. Next class, fifth class is beta adrenergic blocker. Okay, beta adrenergic blocker. Example is propranolol, metoprolol, atenolol is the example of beta adrenergic blocker. Next class is sixth class, alpha adrenergic blocker. Okay, example of adrenergic blocker is prazosin, terazosin, and phencholamine. Okay, next class is seventh class is your alpha beta adrenergic blocker. Alpha beta adrenergic blocker. Okay, labetalol, and carvedilol is the example of alpha beta adrenergic blocker. Next class is your central Central sympatholytic drug. Example of central sympatholytic drug is clonidine and methyldopa. Okay, and last class is vasodilators. Example of vasodilator is hydralazine and minoxidil sodium. Okay, so this is the classification of antihypertensive drug. First class is angiotensin converting enzyme inhibitor. Next class is angiotensin antagonist. Third is calcium channel blocker, then diuretics, beta adrenergic blocker, alpha adrenergic blocker, alpha beta adrenergic blocker, and central sympatholytic drug. And last class is your vasodilator. Okay, so this is your classification of antihypertensive drug. Thank you.